Great presentation from Jay and great leeway into my own presentation. I'm planning on taking a different spin on the COVID-19 challenges in clinical trials. Specifically, my plan is to focus on the speed, the need for speed in managing clinical business operations. Apologies for the phone ringing just now. Okay, so getting started. So let's talk a little bit about the COVID-19 pandemic from a business perspective. And when I say business, I really mean the business side of running clinical trials, which is the planning of trials, the budgeting of clinical trials and scenario analysis, the outsourcing of clinical trials, the management of either new scope or change orders, and the contract management post-award. So we heard all of the impact on the patients and on the site management. When it comes to the business side, we've listened a lot to the industry, to our customers, and this is my quick take on the phases that we have seen and observed during these past few months. Starting initially with the crisis management, where everything pretty much came to a freeze. Everyone was focused on the safety of patients, not so much, of course, on planning, budgeting, or outsourcing, because the effort was really on minimum disruption to the clinical trials. From our perspective as technology providers for clinical outsourcing, we saw a period of hold. But that changed extremely quickly, particularly in the April timeframe, where we saw a massive increase in the need to replan clinical studies quickly. Several events taking place at the same time. One of them was the mid-year reforecast for 2020, already thinking of how the pipeline would look like in the eve of the pandemic in 2021, looking at processing change orders and in general, looking at more remote solutions to enable more efficient work, particularly working from home, because the business side of clinical trials really is about internal sponsor team in outsourcing and also in for the CRO side on the proposal teams. With these, we're seeing now a focus on long-term outcomes, reinventing clinical trials, as we have heard it from Jay as well, with a lot of optimism. People are looking at embracing change and investing in technology and process to obtain sustainable long-term outcomes. And this includes looking at workflow transformation and embracing technology in day-to-day business operations management. With all these activities, there has never been a greater need for speed, information, availability, really at the tip of the, at the fingertips, flexibility, and also the need to simplify some of the complicated processes in outsourcing and clinical trial planning and budgeting. So moving on to the next slide, I really like the image of this lady with a mountain of papers behind her. While we may not have the mountain of papers in clinical trial business management, we have a mountain of Excel spreadsheets. And that is really the biggest pain point in managing clinical business operations, and for the CRO as well in managing proposal teams. We are facing various challenges, particularly related to how much time it takes to actually do routine activities, for example, planning and managing a clinical trial, with the need for accuracy and reliability is higher than ever. Efficiency in outsourcing. We spend enormous amount of time in competitive bidding, putting bids that are unstandardized side by side, trying to interpret the nuances of each clinical service provider to identify competitive advantages. And further down the line, post-award during the management of clinical trials, looking more sharply at the performance of our service providers. So we can really easily track study progress and vendor progress throughout the entire clinical study duration. From this perspective, we strongly feel that Clinical Maestro is really almost built for this purpose. It has becoming an essential component of the digital transformation of the clinical trials because it tackles all these pain points with very powerful solutions. So looking, for example, at the challenge of the massive pipeline planning and budgeting, our solution, Clinical Maestro portfolio, enables the sponsors to get the numbers right, to get a budget really within minutes, do scenario modeling and put side-by-side analysis that show the impact of different decisions on timeline, the impact on timeline, the impact on cost, the impact of the overall operational strategy. As you move along in the sourcing area, sourcing is really a very exhausting exercise for clinical outsourcing department. Our solution, Clinical Maestro Source, it really enables outsourcing teams to get the RFP out very quickly and do the bid due diligence using automation. That eliminates a lot of the guessing and it allows deep diving into various cost driver assumptions, and particularly on the budget challenge, being able to easily drill down to various core cost components, not only direct costs, but also pass-through costs, site costs, number of units, unit cost, the blended resources assigned to each task, which gave the sponsor tremendous power, not only in understanding the bids, but also in negotiating and better selecting the best service providers for their trials. And ultimately, at the end of the outsourcing exercise, there's always an award and the beginning of a long journey that is engaging with the CRO, with the central lab, with the system provider throughout the clinical study duration, and being able to monitor the study progress, not only from a performance perspective, but also for a cost perspective, and for the finance teams being able to get accruals done quickly and do invoice reconciliation, which is what our most recent solution lead is doing. Lead was launched in June, and we are really excited about the level of automation, which is first to market, captured in a cloud SaaS solution for clinical budget contract management. With all of these solutions, we are making it significantly easier for clinical finance teams and clinical outsourcing teams and clinical planning teams to get to the outcomes faster. We are seeing over 95% boost in the speed, accuracy, compliance, and efficiencies in running these core activities in clinical business operations. So with this, I would like to spend the next 10 minutes giving you a very high level demo of how you can perform all of these activities using technology. So I will do a virtual simulated demo of Clinical Maestro, going over all of the core steps, planning a study, creating an RFP, doing bid due diligence, and ultimately managing the contract. For those of you who have never seen Clinical Maestro, this is one of the landing pages. We have the solutions on top, portfolio, source, and lead. They are modular, which means they can operate independently, but they integrate seamlessly with each other. You are looking here at the hypothetical portfolio of 13 programs with 42 studies of different phases, different therapeutic areas, and different models. So the first thing that I am going to do is I'm going to create a study. for the purpose of planning. This is particularly relevant now during COVID, not only for new studies, but also for replanning existing studies. So I'm going to click on this button, create a study. And what I will do is I will start defining the study that I'm going to plan. So I'm going to create a baseline scenario. We have 3 planning modes. The country planning mode, it's the most detailed one, which is appropriate for replanning existing studies or when you are really close to starting a study. The other planning modes, global and regional, are higher level, typically used when you are at protocol synopsis stage or even before that when you are doing long-range planning. So what I'm going to do is enter some basic information on the number of patients, treatment and enrollment duration, follow-up duration, and basic patient disposition information such as screen failure and dropout rate. And moving to the next step, where I'm going to allocate the patients by country and give them an estimated number of sites. Moving on to the next step, I am going to look at what services are going to be outsourced for this trial. In this example, I am choosing biostats and programming, clinical data management, and PV. So it's pretty much a full service RFP or a full service outsourcing model. I could also use a task template, which I can create ahead of time from my configuration settings, but now I'm doing an a la carte selection. So I'm saving these services, and at a push of a button, the system is going to calculate the estimated budget for this cost. The way the budget is put together is using a series of algorithms that are associated with more than 300 unique cost drivers and a master list of tasks that are grouped in each of the services that you can see on the screen, biostats, clinical data management, clinical study management. And if you look on the left panel, these are the subcategories, a snapshot of the subcategories, for example, under clinical study management, where you can add and remove tasks that you are planning to outsource. The system not only gives you an estimated budget, which is 95% accurate versus completed study budgets, but is also going to give you a distribution of the cost over time. This is very important, as I was mentioning at the beginning, for 2020 mid-year reforecast, for 2021 and future years forecast as well. You can drill down at a higher level of detail. Maestro is going to produce a bit grid, which is very similar to what you will receive from a CRO. So under site selection and approval, you are looking at a sample of tasks with the unit of measure, the number of units corresponding to this unique study, the number of hours, the unit cost per hour, and the unit cost, and pass-through cost whenever is required. And it also keeps track of your RACI, which is very, very important, especially now during COVID and during change order, which some of the responsibilities may have shifted. The RACI survives from the planning stage to the sourcing exercise to contract and any subsequent change order. You can log this scenario, you can plan more scenarios. So let's take a look at this particular study, which has 3 different scenarios. Baseline one is the one we were looking at before, and 2 typical scenarios, let's say a slow enrollment and a fast enrollment with more sites. You can see the scenarios, high-level summary, the difference in direct cost, pass-through cost, patient cost, the simulation of a discount that may come from a service provider. And you can compare the scenarios. So let's just do that. When you compare the scenarios, of course, you can drill down at different levels. I'm choosing to look at the direct cost. You can see the scenario side by side. You can decide which scenario you want to compare for variance calculations. And you can highlight certain variances so you can see which scenario produces, for example, the largest cost or the minimum cost. Not only you can do this comparison, but it's very important to be able to see the cost distribution over time and the differences between different scenarios. In this case, you have all three scenarios and looking at the impact on each year of doing one scenario versus the other. That is very important, particularly for biotechs, which are looking very closely at cash flow. They may be in fundraising mode. And of course, for publicly traded companies that are looking at reforecasting and street reporting, this is a great tool that clinical operations teams can use and then coordinate back into finance for aggregated reporting. Moving on, this is just a different visualization of the chart that I've just shown you before, so you can see the variance and the dollar values. And of course, what is really important at the end of the day is to see not only the cost, but also a blended set of information and dashboards that look not only at cost, but also at operational drivers. So in this case, I'm looking at a portfolio view in which I'm lining all of my programs, and in a snapshot, I can see all of the operational drivers. For example, the estimated patient enrolled by program, or the net active sites by program, or the total cost by service category. And this includes both studies that are in planning and the studies that are already running. This is a similar dashboard, very important, looking at the cost distribution over time for that particular study that we were looking at. So you can see that was a demo study, and these were the three scenarios, and this is the roll-up of the baseline scenario. Again, critical information which you can generate really within minutes to be able to provide information to upper management and enable quick decision-making. So now I would like to shift gears into outsourcing. Outsourcing may occur with or without a lot of planning. Typically, the planning is done by the same group that is doing the sourcing, but that may not be the case. Now I'm putting myself in the shoes of an outsourcing manager that has logged into Clinical Maestro, and it's looking at the potential RFPs and RFIs that are ongoing. Let's say that I'm the outsourcing lead, and I can see the status of different RFPs. Some are awarded, some are in progress, and the various bids corresponding to each. So let's take a look at one particular project, outsourcing project that already has bids. And for this case, it has already been awarded. So this is the visualization of an outsourcing manager, and this is an example in which you have one vendor, so it could be a strategic partner, so non-competitive bidding. But in this case, you still have the benchmark, which you generated in planning. So to some extent, Clinical Maestro can be the competitor behind the scene, even when you do single bidding. You can see the list of the bids and rebids that this particular vendor has submitted. Some were canceled by the sponsor, some canceled by the vendor, one was rejected, and ultimately one was awarded. So let's do a comparison using the RFP. I love this visualization because really it enables clinical outsourcing teams to not only do competitive bidding, but also always benchmark the bids to the market. So what you are looking right now is the series snapshot of minor tasks. And in this case, we are not looking at direct cost, we are looking at unit hours. That is very important, particularly during the negotiation process, because it reveals the effort that the CRO or the clinical service provider is putting in achieving a certain task. Moving on, in the interest of time, the project is now awarded, and let's suppose you are a couple of months into the study and you want to manage it actively. So I moved to our lead application, in which you can do contract management via unit reporting. So this is the original budget, was 447 in direct costs, and then you have PTC and total cost and the discount. And this is the forecast. The forecast is where the service provider thinks this particular contract may end up. It may or may not be subject to a change order. So this could be an out of scope tracker or a soft reforecast that may not necessarily trigger a change order. So as you can see, this contract is forecasted to increase by about 30%, a slight decrease in the pass-through cost. And also, you can look at the overall contract progress. In this case, you are looking at how much have we actually spent out of the 447 initially awarded. So about 66% of this direct cost has already been incurred at this time. So let's take a deeper dive of the unit reports. The unit reports are typically set monthly by the sponsor, and they are sent to the CRO or the clinical service provider. So the CRO can report actual activities completed, and they have the opportunity to submit a forecast for the remaining of the contract budget. So you can see at the beginning, of course, the reported budget is small, in this case, 21,000, and forecasting 640,000. As you are progressing, for example, here in the report 6, we already spent 300,000, and we are forecasting to spend another 470,000. You can generate an accrual report using this information, or you can initiate a change order. This is an example of a monthly accrual report, which you can export and send to your finance team. Approaching the end of the presentation with a couple more slides. It's really important for the study teams to monitor the spend on clinical contracts in real time. And these are some examples of the data that we looked before, in which we are comparing the baseline contract versus the current forecast. You are comparing the study progression over time, and ultimately looking at where you are spending your money. So this is, for example, a breakdown of actuals, but also blending information between actuals and forecast. For example, in this case, looking at time spent versus number of units spent versus budget spent. Similarly, it's important to bring in operational data, not only budget data. So this is an example in which you are looking at the progression of the site activation over time, and you're looking at actual versus forecast, for example, on-site visits, and you can look at other metrics related to sites and patients. So using this technology on multiple case studies, sponsors saved significant dollars by utilizing Clinical Maestro to plan, source, and manage clinical studies. Particularly, we have seen significant reductions in negotiated budget due to availability of fair market value information and the ability to do deeper due diligence during outsourcing exercise, and doing all of this effort with significantly less resources and in significantly less time. Ultimately, we are looking at the digital future in which we are all working in concert. With our pharma editions now, the sponsors can plan their pipeline, can conduct RFPs digitally, can manage awarded budgets. And similarly, providers can respond to RFPs, submit bids and rebids, report units and performance, and manage third-party outsourcing, meeting right here in the middle in a more efficient and streamlined clinical business operation environment. So with this, I would like to open the session to questions.
And if you want to meet with Anca and her colleague Farah and Oren, you can use our meeting scheduler link. They're always available by phone and email for next week and for any questions that you may have on the Clinical Maestro software. And there is one question for you, Anca. How have CROs responded to this software?
Um, Very well. We have, I believe, 8 out of the top 10 CROs have already utilized Maestro many more than once. It does ease their work because it allows them to map, for example, their costing tool and bid grids to a single tool, which is utilized by multiple sponsors. As you know, we operate in a highly unstandardized environment, which each sponsor has its own bid grid, has its own RFP structure, and Clinical Maestro with adoption is offering a single interface that makes the CRO's job easier. And similarly to the sponsors, the CROs can get reporting and visualizations and compare bids and rebids across various sponsors or studies of a single sponsor. So we are very happy with the CRO response. And we would actually like to focus one of our upcoming sessions on the CRO user experience. We are working very hard to make the bidding experience very positive for the CRO, and we are open to hearing CRO feedback, suggestions to really make Clinical Maestro the tool of choice for clinical business operations.
Wonderful. And one last question for you, Anca. How is the currency of the data maintained?
It's being maintained through a constant flow of bidding. We had over 200 millions of bids that ran to Clinical Maestro this year alone. As the data is coming through the tool, we have permissions from the sponsors at the MSA level to blind it. And we utilize that data to re-inject it into the planning. When collecting the data, we cannot identify where it's coming from. We only keep high-level identifiers of the type of study and the study phase, for example, for which we are collecting data.
Wonderful.
So it's very current.
Wonderful. And is there any more details you can give on AI in Clinical Maestro? Because AI has been a big topic of today's meeting.
Yes, the AI works perfectly on large data sets, and we are exploring both AI and predictive analytics to constantly re-inject lessons learned and patterns from bid and completed study data and bring that intelligence back into the planning. So we can not only refine the operational planning of various scenarios, but we can better predict the cost. And that includes, for example, future amendments.
The last question would be, does Clinical Maestro offer any standalone consulting services as well?
Yes, we do. That's a very well-timed question for that matter, because we had a press release just today in which we are announcing two service models. One we call the operator model, in which we bring our resources as an extension of the sponsor team operating Clinical Maestro to, for example, assist them during an RFP process or running budgets. And the other service model, it's full service, and it's really geared towards the biotechs that are so busy right now and they are always short of staff. But they still need to get a budget done. They still need to run scenarios. And this service model essentially shifts the work back to us. We can start with as little as a protocol, and then we run the numbers through Maestro, no license is required, and we give back the sponsor what they're looking for, whether it's an RFP or a study plan with multiple scenarios, whatever they need to survive this budget season and to deal with complex outsourcing.
Well, thank you so much, Anca. As I mentioned, if you're interested in connecting with her and her team, please do so at our meeting scheduler website or just shoot us an email, myself, Victor, and Sherry. Thank you again, Anca.
Thank you. Thank you so much. Thank you. Bye.